Going up to the Utah Public Health Association's fourth and final panel in our virtual Advocacy Summit. It's really great to see everybody, and I'm really excited for today's conversation. We have some amazing panelists, and I'm very excited to hear from them and learn from them, and I think we're going to have a really engaging conversation. This panel is focused on addressing racism as a public health crisis and what we as the Utah Public Health Association and public health workforce more broadly can be doing about it. What's bringing us together as part of, and why this is kind of under the fold of the Advocacy Academy, is that we've been talking about how to advocate over the past few webinars. So we've learned about how to navigate the website, how to interact with legislators, and now they're kind of culminating because we're also going to be discussing a bill that UPHA will be supporting, and we'll talk about how you all can get involved and support this bill as well. Representative Hollins will be running a resolution this year regarding racism as a public health crisis. And this is an issue that we know COVID has cast a spotlight on, but is by no means new. We know that health disparities and racism has affected public health and health outcomes for forever as a nation and beyond. And so this is past time and it's past due that we begin to address it. And so we're going to be talking about not only how we can support and advocate this resolution, but also how we can make sure that we amplify the message of the resolution and how we support implementation, how we make sure that this resolution isn't just a nice set of words on paper, but how it's a living, breathing document that we go out and we change our actions, our practices, and we make sure that as a public health workforce, we are truly beginning to address racism as the crisis that it is for public health now. So I'm very excited for today's panel. I'm going to introduce our panelists and just let you all know that we will have Representative Hollins and Representative Daley Provo joining us briefly, but because we are in the middle of the legislative session, they will be zooming in and zooming out. And so we're just going to kind of roll with it and let them speak when they're able to show up, but recognize that they're very busy and it's a busy time for our legislators. Our other panelists, so I'll start with them. So we're going to be joined today by Representative Sandra Hollins, who represents District 23. And she is an incredible community advocate and social worker when she is not serving as a legislator. You know, we have a part-time legislature, as we've discussed, so she wears many hats, but she's truly an amazing advocate, and she is the sponsor for today's resolution. Representative Daley Provo, who will be joining us later as well, is also has her background in advocacy, and she's also a public health scholar and is getting her PhD in public health at the University of Utah. And she represents District 24. We're also going to be joined today we're here. Our other panelists are Areta Tupola, who is an amazing community health worker, community health advocate. She serves and is on the UPHA Community Health Worker section, is also a community health specialist with the University of Utah. And then finally, we're joined by Jason Vitello from Colorado. He is president-elect of the Colorado Public Health Association, and will be able to share with us some lessons learned around how Colorado has begun to do their anti-racist work, some of the lessons they've learned, and how they've started to center health equity and racial and ethnic equity into the association's work and practices. So I'm really excited to learn from all of these amazing panelists. So I think what we'll do is I'm going to ask the panelists to give a little background, I'll ask them some questions, but feel free to ask questions in the chat or comment while they're talking, and then we'll have time at the end for some questions as well. When Representative Daley Provo and Hollins come on, if you want to just put questions in the chat, we can also just address them since they'll probably have to leave by the end. Great. So with that, Areta, I'm going to turn it over to you just to provide some context from what you see and how you see racism affecting public health in your work in Utah, and what this resolution, I know we don't have words for it yet, but what it means and how you think that the public health workforce should be starting to change and shift to recognize racism as a public health crisis.
Yeah, thank you. I in this field of community health, I mean, again, this is something that is not new. It has existed for a long time, and even though COVID has brought a lot of awareness to it, in working with the communities that we work with, which are underserved and um, most of our minority communities, this has been a big issue for a long time, and a lot of people didn't know it. Racism is always something difficult to talk about, and that it even exists, and to even call it out. And during this pandemic, we've been a part of this awareness, but at the same time, in dealing with COVID, we've been trying to educate community, but at the same time take this opportunity to address these the racial inequities that have been going on for a long time before COVID. And how do we, and then when, CARES Act money stopped in December, we were trying to figure out how do we move forward and keep this momentum of having these discussions and saying to our legislators that this is an important thing to discuss, and how we move forward is what we've been pushing is that there's more diversity and inclusion, and we've been seeing that a lot now, during this pandemic, more of these groups being put together to address this or to have the discussion, which was good. We were a part of the multicultural subcommittees of Governor Herbert to be involved and give voice to community about the different barriers that they face in the system as a whole, not just for COVID, but in the whole government system, especially in the health system. And then we've also been seeing a lot of positions for diversity and inclusion directors or program coordinators that have been implemented in different government sectors and university level and all of that. And we love that. But still, there's a lot more to be done. And people think, I want to say, I'm speaking for myself and for just conversations we've had on the ground level, people think that by seeing these things there's change being done, but for a lot of community members the trust is not there yet. And so, okay, yes, thank you for doing this, thank you for putting this community group together, but the question is still being asked, are we really, does our voice really matter? Are we really making a difference? Or is this one another opportunity where we've invited you to the table, we are actually using you to speak for a voice of many, which is not, that's not what we do. We can't speak for everyone, but and then people think that it's okay, but really we want to have a true voice at the table. We want to be able to share these barriers and be a part of the change and the decisions that are being made that affect our communities. And we are still looking for that. I mean, we have been included in a lot of things, but as third party, where someone is still the messenger from these systems to our communities, and then we give that message back, and they relay the message. But we are pushing that to be at the table, so we can be that primary source of communication for our communities, because we know what these barriers are. We face them every day, and to just have someone go and share this and then see it reported like, oh, we've got voice from the community that says this needs to be changed, and then not see a change is why there is so much mistrust. And so we love this, that these conversations are happening. We love being included in conversations, but we really want to help community members understand their rights as citizens, or to be heard. But also we want them to understand that these processes that are we have to go through to be heard, it's not right. And we need to we want legislators, and we want government to know that we are aware of this. And so we're doing all that we can on a community level to really educate about what the legislative systems are, what the processes are, and that in their sharing their experiences of racism or of discrimination, that it's wrong, because a lot of them don't even know that they're being treated wrong in the workforce, in health systems, in all kinds of places. And so that's just some of the work that we're trying to do. But to get down to it all, really, it's the voice again of actual true voice from community about what we experience on the ground level, and making sure that that voice is really being heard by government officials or systems that are making the decisions to change processes or change, the way things are done, and to make sure that it's right the first time. And we know that, sometimes that's not always the case, but if we're at the table, we can help guide that process.
Yeah, I think that's so true. And I think, what you're speaking to is just also like the structures in the institutions, right, that are like designed to exclude. And that's how they've been, built really. And so and I think we as a public health workforce, that's a huge place for us to be, engaging. I think we talk a lot about racism in the trauma on an individual level, which is also important, but we have to be changing these structures and institutions and these power imbalances. And so I think that's a huge piece. How do you that's how do you like elevate that? Because I think sometimes we tend to stay on that individual level, or we tend to, we don't always make that leap to institutions. So when you're having those conversations, how do you, address the systems and the institutions that are, perpetuating racism?
Well, we've been having these conversations on both sides, on a community level, but also with those institutions and systems, so that there's awareness on both sides. We've been doing a lot of, through this opportunity of UPHA and the different sections that are there, we've been trying to do more education to community health workers, especially because that's where I am, about, these different issues, and how we can be more involved. This year, part of our strategic plan is to help give community voice by sharing that information about these different structures that we've identified, are barriers, and trying to find representatives who are, passionate about these areas to get involved by either sitting on a committee in that, for that institution, or meeting with a champion who understands what we do, so that they can hear and give voice to, those decisions that are being made, or the changes that we want to see made. And we've gotten to do a lot of that within the Department of Health by sitting down with these champions who support, community voice, and just sharing, what we're hearing, but also inviting them to come down and listen to these voices firsthand at these, town halls and these community meetings, and other consumers who are using these different institutions, or having to go through these different processes, to hear firsthand what they're dealing with, and why it's such a big barrier for us. A lot of the barriers that are shared are some that, people are not even aware of, and think, oh, it's so easy. I mean, all you have to do is submit this and go through this. Yet, and in dealing with our community, we know that getting to the office to submit that is hard, or not. This digital divide is huge too. There's a lot of our community members who don't understand or know how to use technology, and so we are doing a lot of education on both sides of what we think is important, and in giving our communities voices. It's a start.
Thank you. We're trying to, so Representative Jen Daly Provo is trying to get in. So I think that might be why Jessie just turned off her camera.
Sorry about that. Thank you for that. That was Representative Daly Provo, who's trying to get in, is not able to. So Christy, I don't know. She said she's been trying to log in. But we'll see what happens. Anyways, okay, sorry about that. Well, it wouldn't be like a Zoom panel without some sort of virtual glitch. But Areta, thank you for that. And I'm sorry that I had to go off video for a minute. She was like calling me while I was trying to make that happen. Oh, there she is. Hi, you made it.
Sorry.
No, thank you so much. We were just saying it wouldn't be a virtual panel without some sort of glitch.
Yeah,
Thank
for
you so much
sure.
for joining.
Oh my gosh, it's so wonderful to see all these fabulous, friendly faces. Thank you, public health professionals and devotees.
Thank you so much for being here. I know you have to, we've already introduced you and sung your praises about what an amazing public health advocate you
And I
are.
missed it.
Recorded, this will be recorded, but you know, we're here because we're talking about Representative Holland's resolution, and she'll be popping in as well. And but just wondering if you know, can speak a little bit to the resolution. Areta was talking about with the community as a community health worker lead and community leader about some of the importance of this resolution. Just wondering if you can talk a little bit about it, and also ways that we as members can support, you know, the passing of the resolution, but also amplifying the message.
Awesome. You guys are so great, and thank you. This issue is so near and dear to my heart, and I know that that feeling is mutual in this setting, so thank you. I was approached by a University of Utah medical student who has been really passionate about equity policy issues and has worked with me in the past on, in addition to racism and racial justice, LGBTQ rights as well. And he was a central part of the University of Utah students putting together a resolution asking the University of Utah to also endorse this resolution of racism as a public health crisis, which if you don't already know, I am a student at the University of Utah in public health. So as a student, I was excited to join on signing that as well. But we felt like it definitely deserved a broader audience and more weight. And so I went ahead and opened the bill file. And started getting it drafted based on the wording that was presented at the University of Utah. And then just really kind of had some soul searching. And I had reached out, to be clear, I had reached out to the Quad Caucus in our body prior to and said, hey, I'm really aware of the optics of this, and I'm very supportive, and anything public health is really important to me. But this is dealing with racism, and this is not a lived experience that I have ever experienced, and I don't want to be insensitive to that. And, you know, I think really what the conversation was, no, go ahead and do it. We appreciate your support. Go ahead and run it. And, you know, that might have just been a function really of we've all got a lot on our plates, and it's not a really hard bill to pass, but it's one that takes work. And so I opened it, and I really just kind of had some soul searching, and I called Representative Hollins and I said, Sandra, look, it has to be you. Like you have to lead out on this. I will do anything that you need to help you with it. But this is an issue that you are a community leader on this. You have run these, people look to you for leadership. And it would be inappropriate for her to be the leader on it, but not to be the face of it. And she was great. She said, absolutely, I'll do it. You know, thank you for asking. And Sandra's an incredibly humble person, right? She doesn't do it for the accolades. She doesn't do any of the work that she does for the attention. And I think sometimes it just takes some of us to say, you know, we depend on the leadership skills that you have, and we're gonna make you use them right now. And so I was really, really grateful that she took that on. And she is going to shepherd it through the process beautifully. She will help elevate the conversation. She will help bring stakeholders to the table who feel really disenfranchised, which really is the heart of why we need to run this resolution. We've all known as public health professionals, we all know the profession, the academics of racism is, well, it's been documented for decades that there are infrastructural barriers that are very deeply rooted in racism and policies and structures that were built sometimes very intentionally around disenfranchising people of color. Sometimes maybe not so necessarily so maliciously, but that was certainly the effect. And COVID has thrown a very, very bright light on that. And you know, it's time that we stop saying, oh, let's do some research and make sure that we understand that health outcomes are different for people of color or gender minorities or immigrants. We know that. We don't need any more data to prove this. What we need to do is we need to figure out how to fix it. And I think that this resolution, people argue often about the you know, the real impact of a resolution. And sometimes they're just fluff and sometimes they're really stupid, like a certain basketball resolution that may or may not have passed out of the House yesterday. But I do believe that this is really, really important. This resolution on racism as a public health crisis is critical because it takes it one step further from saying racism is not okay, which it isn't. But racism is so not okay that it is vastly harming people of color in our state, in our country, in our world. And we cannot just sit by and say racist bad. We have to start as a state by recognizing that people are hurting and people are trapped in intergenerational poverty because of mechanisms that they had absolutely no part in creating and absolutely no tools in bridging. And if we can start with this, especially with Representative Hollins leading out on this discussion and her clear, strong, compelling voice, maybe we can get started in the right direction. To be clear, this is not the end goal. This is a first step in a really important journey that we all need to undertake as policymakers, as policy advocates, as citizen advocates, as public health professionals, and just as residents and community members of this state. And so I'm really grateful that you guys are having this conversation and casting light on this important issue. I actually have chills. I'm so passionate about this right now. But Jesse, I don't know how long you want me to talk. You know, I'm a politician and I can talk forever. My day has turned absolutely insane today, capped off by being summoned to the speaker's office, which always makes me feel like I've been called to the principal's office. And I will say I've never been called to the principal's office before, so it makes me a little nervous. So I hate to put stress on the day, but I do want to answer questions or address talking points that you have for me.
No, thank you so much. And I see Representative Hollins has just joined too. I mean, we're so grateful that you both popped into this meeting knowing how much you have on your plate. And I think, you know, maybe Representative Daly Provo, I don't know a few more minutes, but maybe Representative Hollins, if you want to talk a little bit about the bill, and then I can ask you both, like, you know, what can we also do to support it? You know, not just the bill itself, but to carry on the words of the resolution. But Representative Hollins, welcome to the panel. We're so glad you were able to join and know how busy you are. So thank you so much for the resolution that you're running, and that you and Representative Daly Provo have been incredible champions for public health and lifting up these issues. So I'll turn it over to you. I know you don't have a lot of time too.
Thank you. Thank you for the opportunity. I also got called into the principal office, but I get called in so many times that it really don't faze me anymore. I'm always called in because I didn't say it or did something. So thank you all for having me here and for the invite. Those who follow me know that combating racism has been on my agenda for a long, long time. And I'm always looking at policy through the lens of how this is going to affect those the marginalized community, how this is going to affect those in poverty, how this is going to affect people of color in our state. That's the lens that I try to look at all policy through. We know that COVID-19 has exposed us to what we knew all along, the health disparities and the different disparities in our communities. And so part of what I want to do, and hoping that this bill would do, this resolution would do, is start calling for action in addressing those disparities and those social determinants that made us vulnerable to being to contracting COVID-19. We know that racism has long been a problem, an issue in this state. You know, I've heard from some of my colleagues long before the civil unrest began that we have issues in our state, and that if we don't address them, it's going to come to the surface. We can no longer sweep this under the carpet. That's no longer an option. And I said that, I think it was like 2016, I said that to some of my colleagues and some of the leadership, And sure enough, exactly what I said was going to happen, happened. I have said that we need to look at this, we need to address it. And so I think part of what this bill is going to do is start, first of all, calling it out and calling it for what it is, to look at the disparities, but also in our healthcare system, having access. I have not been shy with saying that we need more doctors of color in our healthcare system. I spoke on a panel a couple of years ago, and I told the story about myself being sick for almost a year and not knowing what was wrong. And finally, it was a doctor of color who I went in and told her what was going on. And she said, "Oh, this is what's happening," and was able, and took me seriously. What happened with my daughter in the healthcare system. You know, my daughter got real sick one night and we had to take her to a local hospital, and she was given a pregnancy test and a blood test and sent home. And she got worse through the night, and we took her to another hospital. It was only when that doctor called over to the hospital and was like, "Why did y'all dismiss this person? You should have her there," that they admitted her to the hospital to run more tests. And I know some of that, a lot of that, it's based on racism. It's based on racism, because I cannot imagine any other parent whose child was that sick would have been dismissed in that manner. And so I'm determined to continue to look at policy change. This is beyond us having conversation now. I love the conversation that we're having around racism, but okay, let's move it beyond the conversation. Let's start addressing this issue with policy changes in this state. So with that, like Jen said, we have to go, but I am open for just maybe one or two questions before we leave.
Thank you so much. Is there anything that you need from this group to uplift that message? Because I think you said, like, a lot of your, this is a friendly crowd, but
Yeah.
we don't always have some of your colleagues might not be as open. Is there anything that we can do? We have, this is an association across the state, people, in rural areas. What can we do to make sure that this message isn't just seen as, like, oh, that was a nice resolution, but like that this is serious work and this is how we need to change our policy going forward?
I think one of the things you can do is reach out to your legislator and start having that conversation with them. Coming from me is one thing. I'm a woman of color. They expect me to have conversations around racism. But I think when a lot of you, their voters and their constituents are calling them and saying, look, we have an issue. We need you to support this, but we also want you to support other policies around racism and eliminating racism in this state. So I think that's one of the biggest things that you all can do to help out, is contact your legislator and start having that conversation.
Thank you so much. Representative Daley Provost, is there anything else you'd want to add to how we can make sure that as we champion public health, we're also making sure that racism and health equity is centered in those conversations?
Yeah, I would just say, really taking advantage of the professional place that you come from and recognizing just how multifaceted this is. It's, I think people know, this is maybe a commentary on, maybe some people don't necessarily internalize it or care about it as much as others. People know that in general, racism is bad. But really demonstrating just how impactful it is on the lives of people in our state. It's one thing for people to struggle to imagine being discriminated against while trying to sit in a bus. I think that's as far as their imagination goes sometimes, but really recognizing that this is not just a visual difference between people and a perceived difference between people. This is the health impacts, like the ability for people to live and thrive in a healthy, meaningful way. And whatever that means to them is at stake in public health, and really leveraging your public health expertise and what you know, and how it exacerbates a really intractable problem. And this is one meaningful solution that we all need to get behind, I think, as is going to be really important. So, and thank you, Sandra. It's always, I love listening to you talk about these things. So inspiring. I think we're off to the principal's office now.
Oh my, well, thank you all. Just know that as you go to the principals, you have champions and supporters here, and
Public health.
and that we will be supporting your bill and supporting supporting the resolution and supporting not just the resolution, but committed to action and change going forward. So thank you all so much. Apologies again for the total hiccups getting in, but I'm so glad you're able to be here. And yeah, you both are amazing. So thank you all so much. So with that, thank you all. And I think what I'm going to do is I'm going to turn over to Jason. And, you know, I'm just really excited you're here. And then Aretta, I'm going to actually probably circle back to you afterward just to give you a heads up. But I want to kind of return to this idea of like, you know, what you've been doing in Colorado and really making sure that we're getting into like more meaningful change and that this isn't, you know, this doesn't just become something that goes on the shelf. So, you know, I know you all have been doing a lot of thinking and work about it, and I'm excited to hear what you guys have been doing and what maybe we as a public health association here in Utah can start to do.
Thank you. Greetings all. Thank you for having me. Again, my name is Jason Vitello. I am the president-elect for the Colorado Public Health Association. Probably be the president effective March 1st, pending some recounts we've got going. I'm just kidding.
Like, oh, get spicy in Colorado.
Before that, I was the first health equity officer for CPHA and the first health equity director. I'll tell you a little bit about that. I'll rewind and tell you some of the history that brings us to where we are now. I do want to give a shout out to you all and to your legislators that are leading, you know, the bill. I believe that public health happens more so in the legislature than it does in healthcare departments, right? And to kind of set the table, I like to tell a story. So I wear a lot of hats. You know, I work at Denver Public Health as a behavioral health coordinator, but I also am an adjunct professor at the Graduate School of Social Work. So I'm a social worker by training. And one of the courses I teach there is critical race theory. And I like to set the table and kind of use the framework of critical race theory. And I tell a story that Harry Belafonte used to tell. And he talks about the weeks preceding Dr. Martin Luther King's murder and assassination. For those that don't know, Harry Belafonte, in addition to being an African-American actor in the 1960s, he was a very high-profile civil rights icon and activist who worked closely with Dr. King. And he tells a story that in the weeks preceding Dr. King's murder and assassination, after what could have been considered significant gains had been made in the civil rights movement of the 1960s, what could have been a time of celebration, he said Dr. King seemed very distressed and despondent. And he says that one night they were in a hotel room and Dr. King was staring blankly out of a window. And Harry Belafonte finally asked him, "What troubles you, Brother Martin?" And he said that Dr. King continued to look blankly out of the window for several moments before responding, "I fear I have integrated my people into a burning house." And I think we as professional helpers, whether we're clinicians or working in population health, we very often attend to the signs of a fire. right? The sparks, the heat, the melting furniture, the smoke. We deal with health inequities, over incarceration, higher rates of infant mortality in the Black community, or higher rates of COVID-19 infection and mortality, and so on, without acknowledging the fact that the whole damn house is ablaze. And I feel like we are finally starting to acknowledge that fact and have those conversations in a way that we haven't before. And I think the silver lining of the dumpster fire that was 2020 is that a lot of this evidence and the signs of a fire are being brought to the attention of the public in a way that's maybe unprecedented. Now, we still have a lot of resistance. We still have, and there will always be resistance. There will always be people who fight like hell to remain on the wrong side of history. But, watching white people in Des Moines, Iowa shout Black Lives Matter is encouraging and it's promising. And it's indicative of a precarious yet significant moment in our history that I think public health wants to see grow and be sustained into more than a moment, but a movement. So that movement for us in Colorado probably began, I'd say, around 2016. I was a brand new public health professional, and I spoke at our annual conference, Public Health in the Rockies. And our president at the time, Brian Turner, approached me afterward. I did a talk on, I think, collective impact, collective liberation, and addressing systemic racism head on, the fire. And he approached me and essentially said, and at that time, everyone was talking about equity. And I understand before that, people were talking about diversity. And before that, people were talking about sugary beverages, right? So I feel like I came into public health at a really, nothing against the work, related to that. But I felt like I came at a really, really exciting time where we're starting to talk about the fire and the root causal forces, not just the symptoms of oppression, but the systems of oppression. And he said something to the effect of, if health equity of everyone is everyone's business, then it's nobody's business. We want to make it our business to be proactive in the health equity advocacy arena. And shortly thereafter, I became the health equity director. We started what has since become the Health Equity Coalition. The Health Equity Coalition, it's something I'm really proud of. It's composed of a cross-cultural, cross-sector body of leaders from across the state who are dedicated to the advancement of equity in our communities and in our legislature. We have 3 different work groups. One is professional development and education. And this is kind of the work group that is focused on our membership, which is the public health workforce and our public health students. And we provide a lot of educational opportunity and programming for our members directly related to anti-racism and the advancement of diversity, equity, inclusion. We have a monthly health equity webinar where we engage stakeholders from across the state, everyone from the Office of Health Equity at our state public health department to small grassroots organizations. So we want to kind of uplift, not just focus on what's wrong, but kind of uplift what's going well and who's doing the work. And I think that's a pivotal role of public health, is not to be the guitars necessarily as much as to be the amplifiers or the DJs to the MCs, right? And giving them a stage and a platform to really elevate their work. So that we have organizational infrastructure and development, and that work group is tasked with ensuring that equity is not just an organ in the body of CPHA, but the blood that flow out the ranks of our board to be who we are and what we do. And it to be really infused into our operations, our strategic work plan, our bylaws, and everything that we're about. And then community outreach and engagement, which is our community-facing work group that is really about that proactive policy advocacy and community engagement effort. That's probably the trickiest, but it's the one that has the most potential and the most excitement. So that kind of laid our foundation coming into 2020. And then, you know, with the disproportionately high rates of infection and hospitalization and deaths, as well as economic fallout experienced by Black, Indigenous people of color, not just in our state, but across the country, as well as the nationwide protests, really caused us to go even further and become more progressive in an anti-racist agenda. And we formally announced our commitment to becoming an anti-racist organization at our annual conference. Our president, Kim Boyd, made the announcement. And our intention is to commit to becoming an anti-racist organization and modeling that process for other nonprofits, other affiliates. And because we understand that there are a lot of organizations that are coming to that same level of awareness, right? And I believe that so Angela Davis said it first, the opposite of a racist is not a non-racist, it's an anti-racist. She said that in the 1970s. And America wasn't ready to hear that. We're a little more ready now. Ibram X. Kendi has since said it, and it's the whole premise of his book, How to Be an Anti-Racist. But I think that's raised the bar in the minds of a lot of people, and it's not enough to sit back and say, well, I'm not a racist. The bar has been moved, the standard has been raised, and now you have NASCAR and the NFL, for heaven's sake, right, committing to anti-racist practices. So of course, like not saying something is saying something, right? So we understand that there are a lot of organizations, for-profit, non-profit, that have come as far as we need to do something about racism, to what do we do about racism. We kind of wanted to model what that looks like for others. Part of what we've done is we have utilized the APHA DEI toolkit. Some of us were reviewers on that tool. I would encourage you all to take a look at it and support it. We also put out a request for information with two various, across the state to get consultants to come and kind of guide us through every step of the process. This is a lot of internal work, but ultimately we want this, and the process is the work. But ultimately we very much want this to have a meaningful and measurable impact on our policy work and the communities that we are working with. We made, again, Kim made the formal announcement at our conference in August. The response since then, I think, has been overwhelmingly positive, but we did get some nasty emails from some members who were saying that as a result of our political position, I will not be renewing my membership this year. To which I say, bye. Kim might not say that, that's what I say. To me, racism is not political as much as it is a public health crisis. And it's not, as we all have seen this year, everything has become politicized and partisan. I think fighting racism is the work of all of us. There's plenty of racism to be fought in the Democratic Party as well. I believe it is our role to identify and uproot racism wherever we see it. And one of the things that I would like to focus on in my tenure is this weird divide. When you start talking about equity, this complete resistance, if not outright rejection or disengagement from rural communities, when we're talking about them too, right? So yeah, we are taking a race conscious lens and race conscious approach. I think we've been colorblind for too long, but ultimately this is about creating a world where we all do better when we all do better, and really changing the narrative, which I believe is another role that we have in public health, is to amplify the voices of the unheard and to make sure that counter narratives are included in the dominant or mainstream discourse. And ultimately our role is to help change the narrative, which in turn can change policy and like the material conditions of real people. And that's why we do what we do. But that's some of what we're up to. Thanks again for having me, and I'm happy to answer any questions you might have.
Thank you so much for that. That is so, it's really incredible. And I have many questions, but I want to actually just turn it over to hear your kind of thoughts and take on that, and what Jason shared kind of translates to you in a Utah context and the work that we're doing here. And you can take it any direction you want. I'm just like, I keep thinking what you said earlier, just around like changing the power imbalances and how that's an internal and an external process, and how do we do that and rebuild trust. So yeah, I just want to hear your thoughts, and then we can open it up to other questions. But Jason, thank you for saying that. I wish, yeah, I really appreciate everything you said and want to continue this conversation on going forward.
Yeah, thank you, Jesse, and thank you, Jason, for all of that you have shared. I think we're on that path right now, especially with CHWs being the newest section to UPHA, about 5 years in now, and we are looking really at a lot that you have shared about structural changes. In fact, right now we are building the infrastructure of the CHW section to kind of mirror, not mirror, but support like things that the state is doing, so that we have voice on these different committees that are having these kinds of conversations around equity and systemic processes that really impact our communities. And one of the biggest things that I feel like being a part of UPHA really gave us access to this network of public health advocates and to others in different sectors, to really share the voice of community that I feel has been missing for a long time. And from what I've heard, I am 5 years living here in Utah, and have had to build a lot of new relationships with people and really hear community and their concerns, but also hear on an administrative level or these systems levels, what it is or why it is, things are the way they are. And in a lot of these discussions, people have just said, well, that's just how it's been, and that doesn't make it right. And so as much as we have lost during this pandemic, this awareness of the inequity that has been going on forever, and a lot here in Utah, is something that I'm very grateful for the work that Governor Herbert did, but hope that this conversation and the work that we've been doing with him will carry on with Governor Cox and all of these structural changes that are being made. And I hope that we're able to have more say in what happens with these changes, because that's usually what happens is that we do all this work and put all our efforts into these different things, and then change happens, and then it's like start all over again. And we don't want to see that happen. And so we are working really hard with the same goal that Jason has shared for UPHA, to make sure that we are modeling what we're expecting to see outside, and really giving examples, real examples of how, you know, these changes have improved access for a lot of our community members to resources that are out there for them, but have barriers for them to access them. And so we know that when the government speaks, it's always about funding or about data or about, you know, percentages and all of that. And so we're trying to speak the same language and showing them how much our communities are suffering from these inequities and these policies that are blocking us from access. And so we're doing a lot of education, a lot of training, again, like I said, on both sides. We're working with leadership to build capacity so that people understand what these processes are and can identify what's wrong with them. The hardest part has been calling them out, because people have been reprimanded sometimes for calling these things out. And so we want to support them in any way that we can, and we hope that we're trying to do that through at least this community health workers workforce as leaders of this effort as well. And I love what Governor Herbert has said in a lot of the articles that have come out about this Utah Compact on racial equity and diversity and inclusion, just sharing that this is a movement, not a moment. And so we want to keep these efforts going and just say that we can do better and we should do better. And so we're not going to do this when we have missing pieces at the table. And so we hope to, again, be included on these discussions to help move this movement forward.
Yeah, thank you. Thanks for that. And I, you know, just for everybody on this call, this is something that UPHA will be, you know, I'm excited to keep working with you, Areta, on this issue and really help transform what UPHA can be doing in terms of how we approach our work as an organization. There is a question that came in the chat, so I'm just going to read it. Jason, it's directed towards you. Lots of organizations have come out with statements on racism, but haven't shown commitment to action. As Colorado Public Health Association is modeling how to move beyond a statement and be an anti-racist organization, what do you see as a reasonable first step?
So our first step was utilizing the APHA toolkit and kind of assessing our current state, right? I mean, that's the public health approach. What is our presence, like any assessment, right? Like to figure out where you need to go, you need to figure out where you are. So we did the first step in our toolkit. The APHA toolkit was, you know, to assess where we're at. It assesses readiness, governance, and so from there, we've already put out the RFI to hire a consultant to help us come and help us through this process, right? And with the understanding that on a board, you have people that are in different phases of the work. I mean, in any organization or you have people who are already super woke that are doing anti-racist work. On the other end of the continuum is what we need to attend to. Like, what's on the other end of the continuum, right? Is it people who deny the existence of structural racism altogether, or is it, you know, the well-meaning white liberal who says I don't see color, or so on, right? But figuring out what are we working with here? Luckily for us, everyone at the very least has expressed a commitment to learning what they don't know and doing this work no matter how uncomfortable it is. Our new board members and our new leaders who came in, our president, Kim, reached out to let them know in advance, like, this is the direction that we're going in. Our current board, our executive directors, and our membership seem to be on board with this direction and our commitment to anti-racism. If that's not in alignment with you, then you should probably not proceed. And so far, everyone has been on board. I think it starts with assessment, and I think it starts from there, working with a third party. And I know funding's tight, but like ultimately putting money where your mouth is, and that's the key. it's not about, it's like Cornel West says, right? It's not about being woke. He says, I know people who are woke who are suffering from insomnia. It's not about being woke, it's about doing work, right? And it's about fortitude, and it's about movement, right? And what happens is, and what can keep this moment from becoming a movement is the fact that very often people with privilege, white people, in the case of racism, will see something egregious on television, like what we saw this summer, and they'll feel upset and angry or heartbroken. So they do something to make themselves feel better. They'll donate to BLM, or they'll donate to some cause, or they'll go out and they hold a sign, and then they feel better, and then they don't show up anymore, right? Whatever you do, and whatever you do depends on where you are, but whatever you do, do something and keep moving. That's how movements happen, is through movement. So keep moving, keep struggling. But for us, that was coming to the agreement that we needed to make the commitment, and then figuring out where we are, and kind of agreeing to be comfortable in our discomfort as we work through this stuff together. Because it's not comfortable and it can be messy. But that's what I would advise. Hopefully that answers the question.
That's great. Thank you. If anybody has other questions, please feel free to put them in the chat, or just unmute yourself and feel free to ask too. I know we're getting close on time. Areta, what do you think in terms of next steps? This resolution is coming. We'll send out action alerts to support the bill, or like I keep calling it a bill, the resolution. But what do you, beyond that, like what do you feel like is an important step based on what you've heard around Colorado and just your work that you've been doing to kind of immediate next step for the Public Health Association?
I think just echoing the support of what he just shared. It's just again, I said earlier, like we just want to see these things actually happen, and so we are going to try to support our leaders in making these next steps about putting awareness out there about what it is, and then like you said, share just giving examples of how to do this. A lot of people have been asking us to, like, the same question: what are next steps? What are next steps? How do we address this? And I want to say support this bill first of all, and then be engaged and involved in the conversations that are going on, and not just waiting to see what other people do. To really get engaged by making sure there's representation at your different organizations or departments, so that you are engaged in the conversation and really hearing firsthand again from the people that it's impacting the most, what can be done to help make these changes. I think it's easy, said, but why it doesn't happen is what is like so frustrating. And so yeah, I hope to be a part of it and also get more people involved in just the awareness again, because yes, we said it's happened too long and that this conversation has been happening for a long time, but there are a lot of people that this is like a new awakening for them. They're just really woke about what just happened during the pandemic, and that tells you that something is wrong.
Absolutely. Thank you so much. And Jason, I love that quote too about some people have insomnia. I think that's a really great quote too. It's not about being woke, it's doing the action. And so, this is a process, and recognizing that. And appreciate the resources. You mentioned the APHA REI toolkit. So we'll share that after this presentation too. I know we're up against the hour and I want to respect everybody's time, but are there final thoughts? I mean, there's a lot to unpack in what you shared, and I hope that we can continue to have this conversation too. Go ahead.
I would add, I hope this is the first of many conversations, and I would like to see public health across the country be part of the movement that we've alluded to. And that's going to take communication and a lot of coordinated efforts and collaboration. So however we can learn from and support one another, I'm here for it.
That would be great. Yeah, absolutely. Areta, do you have any final words too that you'd like to share?
No, just thank you for this opportunity to share, and then also thank you all for the work that you all are doing. I know it's a lot, but yeah, it's going to take a collaborative effort, and we just need to keep spreading that awareness.
Thank you so much. I'm really excited about this conversation. I think this gives us some amazing just issues to start to unpack and move forward. So Jason, thank you so much for joining us. It's incredible to hear what Colorado's doing. I know you are also in the process. This is not something that you've all figured out yet, but just hearing the approach that you're taking and the work that you're doing is really awesome. So thank you so much for joining us. Areta, thank you so much for being here and the incredible work you're doing in Utah and continue to be doing, and not just on the public health side, but also in COVID too. You're incredibly busy, and so appreciate you both just for giving your time to support this conversation, and look forward to next steps in continuing the conversation. Thanks, everybody. We'll send out the links and the information. This was our last webinar in the series, and just also look for action alerts about Representative Holland's bill. We'll be sending that out to the UPHA listserv as well. Thanks, everybody. Have a great afternoon. Stay safe and stay well. Bye. Areta, thanks again. I'll send you an email.
Thanks, Jessie. Sorry to miss it.
Oh no, no worries. I sent that link to Christy because we had some glitches, so I was just kind of scrambling to figure out.
She got in. So
Yeah.
yeah, thanks. It was a great webinar. Will you send me whatever toolkit was mentioned?
Yeah, he mentioned the APA, but I'll follow up with him to make sure I have the right one. But he mentioned the APA REI toolkit.
Like, I think he may have misunderstood it. Okay. But if he has some specific concern, let's hear it before it goes to the house. Okay. Sorry guys, I'm doing 3 things at once. So
that's okay. I
hey.
know there's still people on here, so.
Oh, there are, okay.
Thank you, everybody.
Thanks guys, sorry.
Christy, was it really awkward when Representative Daley Provo called, right? Are we still recording?
No,
Yeah.
we're not recording.
It still says recording.
It still says recording.
Oh.